My section isn't too long, so hopefully we'll be short and sweet and get to the questions. I'm sure there are a few floating around out there. With the recent changes to the gay, bi, and MSM policy, who have not been sexually active times 5 years with another man, you can now give blood. Yes, I'm a master at stating the obvious. However, based on Olivier's ad hoc survey this morning, there's one person out there who in 2018 will be eligible, and please come and see me at the end of this talk so I can book your appointment. As already noted, this is an incremental change, and the process is dependent on the new technologies and the data, as well as the demonstration of safety of this first level of change. What can we do? Advocacy and activism needs to continue, and as it has been mentioned already, and I'll just restate it, Canadian Blood Services does not dictate this policy. It's dictated by our regulator, and here's the person to write to. So I will leave that screen up there a moment for a while you're busy jotting it down. I realize it's a rather lengthy address, and if you don't get it all written down, please come and see me, and I will certainly share that with you. So you can certainly address your comments, concerns, and questions to this individual, and keep the issue on the front burner. One of the other options, although the options are limited, we have what's called the Partners for Life program at Canadian Blood Services, and there was an LGBT group at Memorial University at St. John's that became a member of this Partners for Life group, and it is a group that actually brings in eligible friends and family members to donate on their behalf. And this LGBT group is, the number of donations are kept track, and the local donor coordinator at CBS keeps these numbers up to date and forwards them on to our head office, and it's also used in our information that's shared with Health Canada as well. And last but not least, gay and bi men who live in the Lower Mainland in Vancouver can donate at our CBS NetCat or our research lab. As a gay man and a CBS employee, I've been actively donating out at our NetCat lab for a number of years and have just surpassed my 26 donations recently. Prior to the ban coming in effect in the 80s, I was an active blood donor. When HIV hit the scene, I self-deferred and stopped donating because as a nurse as well, I knew that it was in the blood supply at some point in time. Now that I have this option to donate again, and I'm more than happy to be part of it. The other thing that's really important to remember is that in order to advance the science of transfusion medicine, we need human blood. And the only way we're going to get human blood is obviously from a human. The record of donation for the research clinic is mostly focused on the safety of the donor. So not all people who turn up at the research clinic will be eligible to donate if they're taking medications or have a health issue that would potentially cause them harm. If they donated, they would be excluded as well. But we have a pamphlet that will be available out in the break area that will provide you with a little bit more information. And I looked at it earlier, and it made me smile after listening to the YouthCo presentation this morning, where they were talking about the way they communicate and get their information from their sources. And basically it was Twitter, Facebook, etc., and they maybe got one email per 2 weeks. Well, we have the option to write in. Bearing in mind this is targeting multi-generational people, so not everybody has access to the internet. The NetCat clinic books their appointments and manages their donors differently than the whole blood clinic. So what I suggest you do, if you're interested, there's a phone number on the pamphlet. Give them a call. And discuss with them, and they will let you know whether or not you're eligible through the phone. And they're a pre-booked clinic, so they don't have the option for you to walk in. And that's it. The options are not that many at this point in time, but if you have any other questions, and I'm going to turn this back over to Don for any of us, feel free.